So, hello and welcome to Maps Canada Research Room. I'm Akanksha, and Asini, who's also one of my co-facilitators, is also here today. The Research Room is produced by Maps Canada, a volunteer-run nonprofit charitable organization committed to expanding access to safe and legal psychedelics through research, education, and advocacy. The Maps Canada Research Room is a monthly online program that highlights cutting-edge Canadian research and researchers from a range of disciplines within the growing field of psychedelic studies. The Research Room offers a platform for researchers to actively engage with the audience about their current work. Thank you for joining us for today's session. This month is Drug Safety Month at MAPS Canada, and we are thrilled to have Dr. Lauren Airth with us to present her research. Thank you, Lauren, for joining us today. We really appreciate it. So Lauren is a registered nurse and she's currently doing a PhD in nursing from the University of British Columbia. For her PhD, she she completed a PhD at British Columbia. For a PhD, she conducted an implementation science study of a multi-sector university community health authority student-run harm reduction drug checking service that she co-founded and coordinated. Presently, she's conducting research to build robust harm reduction experiential education frameworks for post-secondary students. She's passionate about redistributing resources from resource-rich institutions to address public health concerns. So welcome, Lauren, and I'll get you to start your presentation now. I'll also share your LinkedIn in the chat.
Great. Okay. Can everyone see this slide okay? And it's just the slide, not the notes. Perfect. Okay. Managing multiple screens. So I'm sorry, I'll be looking over here a bit, but I'll try to look back over here and just managing this screen, and then we'll get started. Yeah, so thank you so much, everyone, for being here today. I really appreciate you coming to hear about some of this work. And thank you to MAPS as well for having me here today. We'll be talking about the psychedelic aspects of some drug use in post-secondary settings, as well as sort of the more broader context of substance use there as well. And before beginning, I'd like to acknowledge that I'm on the Algonquin, Songhees, and Esquimalt people's territory. And I'd like to note that today, as we're discussing these things, it's important to note the inequitable drug harms experienced by Indigenous groups globally as a result of colonization. And especially, I just don't think it's possible to have this discussion today without thinking about the harms caused by colonial institutions like universities, and what their role is now as we look at what it means to decolonize drug policies in post-secondary settings and how we can support people who use drugs from that lens. So today in this presentation, I'll give you a bit of an introduction to who I am, talk about the landscape for youth and young adult substance use, and then what that means in the post-secondary context. And I will share a bit about the study that I conducted for my PhD, and then the significance of those findings in British Columbia and in post-secondary contexts. So in terms of who I am, why I'm here, why I'm talking about this, I am an uninvited settler raised on unceded Okanagan Silex territory. And I'm also a registered nurse with acute care and community experience in mental health and substance use. And I co-founded and coordinated the university partner drug checking service in the Okanagan that we'll be talking about today. And as mentioned, I'm currently a postdoctoral fellow with the Canadian Institute for Substance Use Research at the University of Victoria. And I also do postdoctoral work with the Heim Lab at the University of British Columbia. There's their logos. So in terms of the youth and young adult substance use landscape, I think when we talk about the unregulated drug crisis, we're often speaking about it in broad terms, but it's really important to consider the population-specific impacts and strategies. So particularly for youth and young adults, When they're using substances, this is influenced by role transitions, by their peers, desires for socialization, improved performance, self-medication. These are fairly common reasons for why people use substances. Obviously, the peer influence at this age is a little bit stronger. We see a little bit more influence there. And I think a lot of us can appreciate when we were a youth or young adult what that looked like for the substance use landscape for us. And some studies show that for youth and young adults, there's a higher prevalence of substance use when compared to the general population. So a 2019 Canadian study showed that 14% of 20 to 24-year-olds used unregulated drugs in the previous year compared to 3% of people over 25 years of age. And similarly, in the United Kingdom in 2024, a study showed that in the past year, 16.5% of 16 to 24-year-olds had used unregulated drugs compared to 9% of people 16 to 59 years of age. And unregulated drug use and disorders are more prevalent amongst youth and young adults compared to the general population, and we see that in a number of countries around the world. As a result, young people are at risk of experiencing harm from unexpected contaminants or adulterants in the evolving unregulated drug supply. And we're seeing more and more incidents of novel substances being introduced, especially as people experiment with creating novel designer drugs, as well as drugs that we're hearing often about in the news, like benzodiazepines and xylazine and carfentanil and things like that. In the United States, from 1998 to 2018, there was a 760% increase in polysubstance-involved deaths amongst 13 to 25-year-olds. And in British Columbia here, there was a 406% increase in the annual unregulated drug death rate amongst 19 to 29-year-olds from 2014 to 2024. So we're seeing some significant harms for this population. In terms of the post-secondary setting, where we know this population is highly represented, in Jordan and the US, researchers have found that post-secondary students have a higher prevalence of substance use than their non-student peers, so folks who aren't in post-secondary. And after entering a post-secondary environment in the UK and the US, there are some studies that show students are more likely to increase their substance use and their role in supplying substances there. In Canada specifically, a study from 2021-2022 found that 13% of student respondents recorded misusing regulated drugs. And I want to note misusing is the terminology that was used in that survey. It's not necessarily reflective of my practice or ethics or how I view these things, but this is the data. So 13% of student respondents misuse regulated drugs, 12% reported using unregulated drugs, and 23% reported being harmed by their drug use. And when we're looking at these statistics, I think it's super important as well to talk about just the bias in reporting and what happens for students who, as you'll see what came up in our study, there's a lot of fear around academic repercussions and who's going to access that information and what it will mean for them professionally or academically. So it's most likely that there's underreporting of these things. So given that we're seeing these harms happen to youth and young adult populations, and we're seeing folks in post-secondary settings using substances, there's a call for increasing harm reduction interventions at different post-secondary spaces, and we're seeing an increase in a number of different strategies that are actually being implemented as well. But I put a little asterisk there by the US because in the current political climate, obviously, it's very challenging for us to be implementing things that are progressive or pushing things in the harm reduction fields. And drug checking is a harm reduction strategy that's used worldwide that can reduce the risk of consuming unexpected contaminants and adulterants. So as I mentioned earlier, that is a large reason why people are experiencing harm when they use unregulated drugs, including psychedelics. So drug checking can monitor drug supply trends, it can provide personalized harm reduction information about the contents of service users' drugs, and it can facilitate engagement with health and social services. So drug checking effectively reduces the potential for harm for people who use drugs and their communities, and there's a lot of research out there to show this in festival and community settings. But we don't see a lot of evidence out there exploring what this looks like in post-secondary settings. So at UBCO, to give you the landscape a little bit, UBCO is the University of British Columbia's Okanagan campus. So it's in the southern interior of British Columbia, also on unceded territory of Okanagan Silex Nation. And this campus has about 12,000 students. And in a 2022 undergraduate survey, student respondents reported 16% of them reported using unspecified substances other than alcohol or cigarettes to relieve stress. And in the same survey, there was a number of students who, half of the respondents for that survey lived in housing on or near campus, which is important when we think about where resources are located and how people are comfortable accessing those and how accessible resources are. So in 2019, I was working as a campus health specialist with the university's campus health unit. And we conducted a number of community dialogues to understand how students were being impacted by unregulated drugs and what their health needs were so that we could better support them. So what came out of that was that students felt like there were no resources for them when it came to substance use health and knowing how to look after that. And they also identified drug checking as something that they were really interested in. So in September 2019, myself and my colleagues partnered with some student clubs to figure out how we could bring drug checking to campus for the start of year student union party. We did this sort of independently, gathering resources, talking to the student clubs, figuring out how to bring drug checking on campus, and then involved university administration and leadership just a few days before the event, about 2 days before the event, to say, hey, we planned this, we booked this, it's happening. And that put them in a position where they had to very quickly decide if they were going to allow it or not. And thankfully, we got the sign off for some insurance to happen for that event within 48 hours. And then administration actually attended the event to see how it would all go because they were concerned about what would happen with drug checking at this event because they hadn't done something like that before on this campus. But because of administration attending that event, they actually saw how successful drug checking was and also how challenging and problematic some aspects of party culture were at the school at that time. So it initiated a lot of really beneficial things. But one of it was that we started a number of conversations with administration for a number of months after that, up until February 2020, when we had permission then to operate as the harm reduction team there, or what we call HART for short. And HART was implemented through partnerships with diverse staff, faculty, students, community members, including activists, harm reduction groups, and the regional health authority, including harm reduction experts. And across all of these groups, we included people who use drugs. So to implement drug checking at UBCO, what this looked like was that I completed drug checking technician training at the BC Centre on Substance Use in 2020. And then Interior Health reached out to establish a contract with HART in the fall of 2020. And this contract included an FTIR, which you can see in the photo here. And that's a machine that can find the top 4 to 5 ingredients present in a sample at a concentration of about 5 to 10% or greater. So it allows us to provide people with the information about what's in their drugs and they can avoid consuming things that they didn't want to. To run this program, we hired work study students to be the drug checking technicians, and it worked out really perfectly because it just so happened basically that when I was in my role as a campus health specialist, some of the work study students had already done a science degree and then were doing a nursing degree. And you'll find in most labs, most university labs across the world, these sort of spectroscopy machines are not uncommon. So most of the time, science students have actually had training on these instruments and know how to use them. And they just need that little bit of extra like training and support to learn how to use them in the context with unregulated drugs. So it's another point, I think, for why universities are a perfect place to have drug checking, because you already have students who are trained on these machines, who can develop really innovative technology, who can put their skills to use in these interdisciplinary settings. So we hired some students to be our drug checking technicians, and then we began providing drug checking services through the health authority and through different nonprofit spaces as well at 6 different sites in 3 cities. And we were supported by over 16 community partnerships. So we opened up pretty big, pretty fast, which came with its own challenges. But today we were focusing on the campus-based aspects. So we were able to operate on campus because UBCO subsidized the services that we made available there. So we prioritized community settings. And then when the FTIR wasn't being used there, we offered services on campus. And then the training and support that I received as a drug checking technician was also given to our work study students so that they could, like I say, become more comfortable and using these machines in the context of unregulated drugs. So to launch these services at UBCO, you can see sort of the schedule that we had there and where we were operating. And we used guidelines that are available from the BC Centre on Substance Use. So when service users came into the space, we tried to make it like a bright, happy, engaging space where we'd have music playing. We'd have a bunch of like resources laid out for folks that they could check out. We had all the postcards that have like the name of a drug, and on the back it has objective information about what is that drug, how do people use it, how do you reduce your risk of harm when you're using that drug, all those sorts of things. And if someone wanted to get their drugs checked, they would provide a sample that's about 2 milligrams, or the size of like a head of a matchstick or the size of a grain of rice, are sort of the common comparisons we use. And, and then the student drug checkers would analyze each sample using the FTIR, and then a few grains of the sample would be dissolved in water to use with benzodiazepine and fentanyl immunoassay strips, because these strips are highly sensitive and can detect those drugs if they're present in that sample at below that 5% concentration rate. And the great thing about the FTIR that I found is that afterwards, students can have the sample returned to them, which we found in different settings, folks are concerned about wanting to not give up too much of their sample or not lose too much because drugs are expensive. So the overall number of drug checks that we did in the community from November 2020 to April 2024 worked out to almost 3 samples an hour, or over 1,600. And on campus, it worked out to almost 1 sample an hour. So from September 2021 to April 2024, we checked 121 samples. And I always like to note with this, it's important to say that our drug checking service ran from basically September to November, and then January to early April. So we followed the heavier side of the academic schedule, I guess you could say. We also closed for student breaks. So often on long weekends, we had reduced hours, those sorts of things. And of course, it was peak COVID times when we started this program. So at UBCO, classes didn't return for a full in-person academic year until 2022. So that is an important thing, all this context to keep in mind when you're looking at the number of samples that we did check. But as a result of implementing this program, we started to see a culture shift. And HEART didn't just include drug checking. And I think it's really important to talk about this, because to bring drug checking onto a campus, if it's just drug checking and that's all you're doing and you're not talking about any other aspects of harm reduction, you're not addressing the full scope of what needs to happen there for harm reduction knowledge, right? So we also did naloxone distribution and training. We did that through workshops or one-on-one sessions. We provided sterile supplies. We provided educational resources. We did a lot of advocacy around party culture and thinking about how we could establish a harm-reducing party culture, essentially, and partnered with a lot of intersectional groups. So we did work with the Pride groups on campus and making sure that we were bringing like Pride-oriented harm reduction resources to their events, and working with different equity, diversity, and inclusion groups. We worked with Indigenous programs and services as well to think about how we could decolonize and indigenize harm reduction resources for students who were interested in that from that group. So people began to see HEART as a source of authority on these topics and a non-judgmental space where they could come and talk to us about things. So we built trust over time, and students began attending drug checking services, not just to check drugs, but also to talk about their drug experiences. So sometimes they wanted to share that they were really excited over how a drug had helped them overcome a challenge. If they had concerns over their dependence on different drugs, experimenting and making their own drugs, or trying a drug for the first time. So we had a lot of students come in who were excited about experimenting and making their own drugs, particularly with different psychedelics, which was really interesting to talk to folks about their experiences and how they were making it, what they intended to do with it, all those sorts of things. And I think it's a perfect example for, you have students coming into a post-secondary setting where the research is showing that there's this increase in general substance use experiences. People are experimenting, they're, away from home, they're trying all these new things. And they're also learning in their chemistry classes, all these different skills. And so you see a lot of folks beginning to experiment with making their own drugs. And it makes sense to me that we would also have a space then for them to check what they're making before they then consume something that they don't know for sure what they've made. And we also started to implement Party 101 workshops. So this became an annual thing on campus where anytime orientation is happening in late August, early September, we offer our Party 101 workshops for all incoming students, and it's implemented into some of the regular orientation programming. So we reach hundreds and hundreds of students coming through. And we talk about different kinds of substances that we commonly see brought in for drug checking or that are talked about when we're on campus, and talk to students about what are those drugs, how do they impact you, what is the impact of mixing different drugs, how can you be a good party host, all those sorts of things. So from September 2021 to April 2024, you can see the kind of breakdown here of all the different sorts of substances that we were checking and when. But psychedelics overall were what were brought in the most by students on campus. But one thing I think is important to note as well is that over time, we did have more and more students coming in to talk about their use of different depressants, including opioids. And I think it's a common misconception that students in post-secondary settings aren't using drugs like opioids, is something I'm often told when I'm doing advocacy work in this area. But in reality, that actually just doubles down on the stigma for students who do use opioids or other sorts of depressants. They are using them. It's just that they feel like they shouldn't be because of this narrative. And so setting up drug checking programs, it's important to talk about the drugs that are commonly used. Like I say, a lot of psychedelics and stimulants, those sorts of things, but also depressants are used by students. And we do want them to be able to feel like they can come and talk to us about that and get those drugs checked and receive, non-judgmental harm reduction information for their use. So for my PhD, I started it at the same time that I started the drug checking program. So it was quite a wild ride, but I decided to study the drug checking program. So I conducted an implementation science study asking what is the reach, impact, and feasibility of a university partnered drug checking service. And I used the lenses of critical social theory, harm reduction, and integrated knowledge translation, as well as the REAM implementation science framework. So that allowed us to break down our findings into looking at what is the reach of the program, how effective is it, what does adoption look like, implementation, and maintenance. And this study was funded through a Health Innovation Funding Investment Award and a Health After 2020 grant. And we conducted recruitment for the study from May to December 2023, and participants included decision makers for HEART, drug checking technicians who worked for HEART, and then students and community members who used drugs. So for data collection, you can see in the little chart on the side over here, students and decision makers did individual interviews. So these were recorded and they were either done in person or online. And drug checkers did an online survey. And this is because we worked with a research team who informed the way that we conducted this study. And drug checking technicians felt like they would be less identifiable if they were providing information through an online survey. That was obviously an ethics consideration for the study, is that I was the program coordinator as well as the researcher who was studying this. And so research assistants collected data for this, and all of the data was de-identified before it was seen by me to make it as separate as possible. But obviously there's those inherent risks then. And drug checking technicians and students were also invited to submit art pieces to inform the research questions. So I'm an arts-based researcher. I try to incorporate that into my work because I believe that it brings out narratives that are then owned by the participant. It helps to counter different Eurocentric narratives in research. And so we encourage people to then also provide art pieces, which we followed a whole process that I won't go into detail about, but in terms of making sure that those things were funded and available to people who did want to make them. So then for analysis, we use descriptive statistics for any demographics information. We broke down the qualitative information or the qualitative data that came from interviews into the different REAIM domains that I mentioned. And then that was analyzed using constant comparison. So reading over the data to find the common themes. And then once we had the common themes established, those were shared back to participants in a member checking process to see if the findings did actually reflect their experiences. So you can see here the demographics of the folks that we had participating in this study. We had a small number of students, and the recruitment period that we had for students was from around May to September for that portion of the study. So it was a challenging time to bring students in, but also challenging in general to get students to come forward to talk about their drug use. So this is something to build on in future studies, but we had 4 students in this study, and then we had 13 drug checking technicians and decision makers. I think an important note about the drug checking technicians as well is that not all of them would identify as someone who uses unregulated drugs, but the majority of drug checking technicians had experience in different ways. And so the data that is shared here is representative of their experiences in a different way as well. Overall, the majority of participants, though, were between 19 and 35 years of age and were straight white men with a regular job earning less than $40,000 a year. So we received one art piece submission, which came from Peyton, one of the students in the study. And I've broken down different aspects of this art piece that I will share as we go through the findings, but I wanted to show it here in its full form so that it can be appreciated like this. And I think it's, like I say, I love art when it comes to research because I think it just really shows the person's actual narrative, their experiences, what they want to share with people. So I hope that everyone can kind of take a moment to take this all in as the full piece before we break it down a little bit more. So the first category of findings is the reach category. So thinking about who is accessing drug checking services and why or why not. So we found that it's probably not surprising to folks, but criminalization does inhibit the reach of these services. So students were fearful of accessing them, especially if, because we also operated at different student events, like I mentioned, that big student union party. So if there were police milling about, that kind of thing, people were very fearful of accessing services because they didn't know what the repercussions would be. And those weren't always clear to people, even though um, we have all of the legal exemptions in place to be able to operate and service users are protected. There's a big gray area surrounding that. So that came across in what students were sharing about the fears of criminalization and what drug checking technicians and decision makers had seen as well. And then this related to uncertain academic repercussions. So interestingly, a number of participants said they were very familiar with provincial legislation and what this looked like on a provincial level, but they weren't sure how that translated then to campus because campus hadn't been clear about, especially in when we were talking about decriminalization and what that looked like here in BC, it wasn't clear how that translated over to different campus policies and how someone might be punished or not punished for having drugs on them or using drugs on campus and what that meant. And there's a lot more I could say about that, but I'll save it for the discussion. But yeah, so that came across in our findings, as well as public and self-stigma. And so students shared, interestingly, that in some cases, they had older acquaintances who they would be out using drugs with. And those folks would sort of imply that it was a bit nerdy to check your drugs because they had come up in an area or in a time of unregulated drug use when it was a little bit more fun to be experimental and it didn't carry all of the same risks that the unregulated drug supply does currently. So there was the influence of older acquaintances who were sort of like, well, what's the point in that? That's a nerdy thing to do. Why would you do that? And drug abstinence campaigns. So you can see in Peyton's art piece here in the upper right-hand piece of this slide where you can see the Dare to Resist Drugs piece. And I really like how they have a hand reaching out from that side, offering drugs, on the other hand saying no. And what Peyton wanted to explain with this part of it is that despite Dare's best efforts, people will still offer drugs. And even if you try to say no, eventually at some point you're going to take them in because all the pills and things that are being put into someone's head in the larger art piece there. So they talked though about how Dare ultimately didn't stop anyone from using drugs, but it made them feel like bad people for using drugs and even for accessing harm reduction services. So that had influenced the way that they thought about harm reduction. And interestingly, a decision maker in the community, Charlie, said, having the service at the university totally makes sense to me because there are people in the city, there's no chance they would ever enter the overdose prevention site. So that was part of the discussion, is that while there's all this stigma for students, it was important to have the service on campus because it catered to a population who maybe wasn't always comfortable going into spaces like an overdose prevention site or like other harm reduction nonprofit sites that we worked out of. So while the stigma existed on campus, there was a belief that there was less stigma to access that on campus than to access the service in the community where it wasn't as student friendly or built around student needs. And the timing of the services also made it a bit challenging. And so we didn't have funding to be operating, all day, every day kind of thing. And so students shared that there's a quote from one student who talked about how it's like you have to plan to see your dealer to get your drugs before the drug checking date, and you have to make sure that that's before the event that you plan on using those substances at. So the less often that drug checking operated, the more challenging it was for people to access it. And Drew also said there's some weekends that are coming up when everyone wants to get plastered. There's the high season and the low season for drugs. So they also felt like there should be increased hours around certain times, like around long weekends or those sorts of things, when more students are using substances. But they also were interested in accessing drug checking services to care for their well-being. Most of them shared about an awareness of the unregulated drug supply, how it was impacting folks. And Peyton said, I don't want to have to choose between having the time of my life and losing my life. The students also felt like, you can see in the pink pills there, the different people in the pink pills in the bottom left-hand corner of the slide, that everyone should be able to care for their well-being by accessing drug checking services. And so participants really emphasized that they wanted drug checking services to be available on campus, but they didn't want that to be taken away from the community. They wanted everyone to be able to access drug checking services for whatever reason that they use drugs, just for this service to be normalized so that people can care for themselves. In terms of effectiveness, we found that the service was destigmatizing. And so by bringing it onto campus, it helps people feel more comfortable having these conversations. They felt like they weren't bad people for having these conversations, and like they could engage with resources and take care of themselves and others. So as Peyton said, knowing that I can go to my school and that there's other students my age checking drugs to make sure that I'm safe and my peers are safe, it alleviates some of that shame that I have. It also decreased the use and distribution of potentially harmful drugs. So students talked about how finding out what was in their drugs prevented them from taking it. In some cases, they also disposed of their drugs, and they made sure not to share those drugs with their friends if it had ingredients that those other folks were not interested in consuming. And students shared that accessing the drug checking service helped to reduce their anxiety and increase their ability to care for their well-being. So you can see in Peyton's art piece here, where there's the person sort of rolling around on the bed. It's sort of a blurry figure. They were using that to reference the sort of anxiety that they felt before drug checking services existed, and the amount of fear that they would experience when they took a drug, and then being concerned about, like, did I just take what I thought I took? Is there something else in it? I don't know. Whereas after accessing drug checking, which you can see spanning across the art piece here, there's signs towards drug checking. They felt like it decreased their anxiety. They could care for themselves a lot better, and then ultimately have a better experience when they were using that substance, which then improved their overall well-being. And this is also something that came up for folks who talked about having their friends access drug checking. They were able to feel more comfortable partying with friends who they knew had checked their drugs, because they didn't have to worry about something bad happening. And so it's not just about the students checking their drugs, but the other people around them also feeling safer, more comfortable, which ultimately then has a positive impact on folks' mental health. And Avery shared, heart's where a lot of my knowledge around drugs that I've tried comes from, or I should say the informed knowledge that I can back up. So we saw a lot of students just gaining knowledge from coming into the service and being able to share that with others. The influence of this extended beyond campus. We heard students talking about how they shared about drug checking with their friends who lived in other cities that didn't have access to it, and then helped those friends figure out how they could access different, like, at-home drug checking resources online or through other underground sort of networks, as well as sharing with those friends the information that they got from the campus service. And a number of students also went into their community workplaces and then taught them about naloxone and trained them in how to use naloxone, brought in naloxone kits. And so it was really neat to see how it wasn't just the uptake from students, but then it extended out into their social circles. And this also included the drug checking technicians. And so because we were training students as drug checkers on campus and they were getting all this harm reduction knowledge, then they also became desirable employees for the harm reduction fields. You can see Jan said that Heart philosophically created good harm reduction people, and they were saying that in reference to the fact that a local nonprofit was reaching out, wanting to hire students who would work for Heart because of how they felt about those students. So regarding adoption and implementation, these perspectives largely came from the drug checking technicians as well as decision makers. But there were challenges around the inadequate funding and policy and infrastructure pieces. And one of the main things that came up was concern around liability risks. So there was the belief that administrators at the university were concerned about liability of providing this program and what that meant. And because of those fears, there was a belief that the university was not buying into the program as much as they could be, and that the program was very much at risk, which then made other partners hesitant to partner with the university because they looked at that and were uncertain about what sort of investments they wanted to make if the program was then just going to be cut and they'd be left high and dry, those sorts of things. And without really clear infrastructure around what drug checking looks like in universities, it also led drug checking technicians to be uncertain about what their scope and role might be and how to work within that, because it is just a novel field in general, but especially in a post-secondary setting. And this is where Jan also said, sometimes academia is good at the vision of something and questioning, is this how this should go? But lots of folks had never actually implemented a program or created the infrastructure. So the benefit to the intersectoral way that this drug checking service operated is that it did expand the resources that were available to all of the partners involved. So for drug checking technicians, those students, they got to learn from people on campus, as well as people with lived and living experience of substance use in the community and harm reduction experts in the community. And they really got to take their classroom learning and their lab skills and actually apply it in a real world setting and really see how that could be used to bring change to public health crises. And for our partners in the community, this also allowed for the expansion of some of their resources because we were able to bring university students into those spaces to expand the services that they were offering. And we could apply for a number of different university grants that helped to sort of fortify and expand the services that were being offered through those partnerships and the technology sharing that we engaged in. This also raised questions, though, about whether or not the university should be holding the drug checking contract when it was already a resource-rich institution, and whether those resources could be better used by community groups. And as I mentioned, there were the innovative experiential education opportunities that happened, but relating back to the quote that I shared here by Jan, there were challenges of not being integrated into a larger harm reduction organization. And so where you typically, if there's a nonprofit organization that offers drug checking and you have someone who calls in sick, you have a number of other employees who can help cover that sick call. But in the context of this space, it was very limited. We'd have one or two drug checker students on at a time. And so if there's a sick call, it's a question of like, well, are there even going to be services this week then because of it? So that was part of the other challenge there. In terms of maintaining the program, we'd established memorandums of understanding between the different partners. And while these helped navigate some of those partnerships, they did desire clear distinctions between the research aspects of the service, the resources that were being shared, and who was covering what roles. So those were things that were identified as there being a little bit of a gap around. For students, they saw the value in this service and plan to continue using it. So as Peyton said, they deemed the service worthy, even if she did have to travel, take a little bit of time, do a little bit of extra planning. Drew said, I'm going to get my buddies to collect their drugs, bring it here, test it for them. And Avery shared that drug checking had become a pretty common thing around their group of people and that friends don't take drugs that they don't test now. Unfortunately, we found the lack of university policies fed into this sort of vicious cycle in terms of maintenance of the program. So because of the lack of policies, that perpetuated fears of stigma, academic and professional repercussions. There were insufficient resources to be able to provide staffing and funding for the program, which then meant there was limited capacity for services, research, policy development, and advocacy. And that limited data showing the value for and need for the service, which then contributed to hesitancy from partners and made the service vulnerable. Ultimately, this actually led to the termination of the program in June 2024. Actually, a year ago today was the last day in my position with the university in that specific role. And that came out of a number of different legal conversations with the university and things that I won't unpack here necessarily, but I think it speaks to some of the challenges that came up in this study. And thankfully now the drug checking on campus has been reinstated. There is more robust policy being reintroduced around that. The drug check or the Heart at UBCO now has their own FTIR for drug checking through some money that came through that program. So everything is being reintroduced in a much more policy supported way. So I think it was a challenging time to have those services pulled back, but they're coming back in a stronger way. So in terms of campus-based drug checking, we found that it decreases risks. So it helped the students in the study reduce their risk of harm by informing them of potentially harmful or unexpected ingredients. And this, in the research literature, is a very commonly cited driver and outcome of drug checking service use. But I think it's important to note that in BC, we've lost over 1,700 people 19 to 29 years of age from unregulated drugs since 2019. And so it's really important for us to be considering what strategies are going to be effective for this population. And this study that we conducted corroborates research showing that drug checking results can also motivate some users to dispose of their drugs. And it limits, like I say, the use and distribution of drugs that have the potential to cause harm. So it's important to think about how we can better use drug checking as a strategy in post-secondary spaces. And we also found that it positively impacts mental well-being. So as I said, anxiety decreased, there's a sense of well-being increased, and that included friends of people who use drugs. And substance use stigma was decreased after the campus drug checking was introduced, but stigma was also noted as an access barrier, particularly with the lack of drug checking policies at the university to be able to protect the service, to protect service users, those sorts of things. And this is also reflected in the literature where it shows that there is a high prevalence of substance use stigma in academic settings. And like I said, especially for particular types of substances. And this is where I think it's important to tie in the theory of set and setting, where we've talked about this a bit as a research team, but thinking about how one's mindset and environment influence one's experience with a substance. If students are using substances on the post-secondary campus, or even with other friends from that post-secondary environment, and that environment is helping to provide information that reduces their risk of harm, that helps tell them, you know, you're not a bad person because you use drugs. You're not a bad person for accessing harm reduction. You're looking after your health by coming here to this service. You're taking care of one another and creating that culture of care, which is something else that actually came up from the study as well, is that decision makers talked about speaking to students who said that they really valued being at a university that had this available so that they could care for their community in that way, whether or not they use drugs. So it just thinking about the theory of set and setting, having services like this on a campus help to promote those better, I hesitate to use the word better, but I think more health promoting experiences, I guess, with substances. And this quote here from the paper that says, positive set and setting conditions is one of the first actions which can be undertaken to reduce drug harms. So if universities are wanting to reduce drug harms, it makes sense to introduce this into the environment. But it also requires that coupling of destigmatizing policies to support the intervention. And drug checking on a university campus helps expand the influence of the intervention. So service users often share drug checking results with others, as well as through public reports, which we see in the literature. And in this particular study, we found that service users shared about and encouraged the use of harm reduction resources with their social circles. And in thinking about youth and young adult health, we know that in the literature, these folks exert influence on one another's substance use behaviors. And often that's talked about in a negative way where there's peer pressure around drinking or those sorts of things. But I think it's also important to consider how youth and young adults can influence one another's substance use behaviors in positive ways to promote these healthy subcultures where it's like, oh, hey, we're all getting MDMA tonight and we made sure that like Joe went and checked it and here's the results and here's what they said about like how we might want to dose it so that we don't hurt ourselves tonight. You know, like that's the flip side to that sort of influence as well. So in thinking about why universities are a place for drug checking and why this shouldn't just be outsourced to the community, recent guidelines from the government of BC encourage post-secondary institutes to implement overdose prevention and response strategies. And a quote from those guidelines is that post-secondary institutions play a vital role in supporting the prevention of drug overdoses. As respected institutions embedded in communities throughout BC, post-secondary institutes are seen as places of learning, truth, and knowledge. They value research-informed decision-making and bring expertise in the areas of teaching and collaboration between research networks, government, and community organizations. So there's support for this work slowly forming, but I think we need to move beyond overdose prevention strategies and thinking more upstream. So with HEART, you know, we help to train harm reductionists, possibly increasing the capacity of the overburdened harm reduction field and relating it back to this quote. It isn't just about the university, right? The universities don't just exist independently of the communities that they plant themselves in, but in thinking about overdose prevention and response strategies, how are we really implementing those in a way that can better support the communities around us? And Substance, which is part of the Canadian Institute for Substance Use Research at the University of Victoria here, is another example of an organization that's working to do these things in BC. So they facilitate drug checking technology innovation and provide experiential education opportunities for students from the University of Victoria in the community. So they've actually seen 28 graduate degrees completed or in progress, 2 postdoctoral fellows, 34 field education placements, and 12 directed studies students. So there's a lot of potential around these sorts of programs being implemented into universities in terms of the research work that can come out of it, and the service work that can come out of it, and the policy work that can come out of it. And when we're bringing in students who use substances, they're bringing in a lived experience that really informs this work in a way that elevates it to another level. And the Hein Lab at the University of British Columbia's Vancouver campus is another example of where this kind of work is being done. In that lab, they've made really important drug checking technology innovations and contributions to support local drug user groups. And that lab also has the potential to engage over 20 undergraduate and graduate lab students. So this is just like a handful of examples, and you can see how much potential there is for universities to be contributing to the expansion of drug knowledge, of drug checking knowledge, of harm reduction knowledge, of innovations in this space, of how we're engaging with psychedelics and other drugs, and how we can do that as a community to better support one another. And yet, historical societal norms are weighted more heavily than the actual risk and indeed the benefits of these sorts of things in post-secondary settings. So universities are also a place where we need to see better drug policies implemented. And the literature shows that there is an interest in clear drug checking service guidelines to support implementation and operations. And we saw in this study, particularly, there's a need for that in post-secondary institutes because guidelines right now are specific to community and event contexts. And as places of innovation and truth and reconciliation on Indigenous land, universities need to consider what it means to decolonize their thinking around drug policies and indigenize their practices in this area, as well as to address inequities caused by colonization as colonial institutions. So I wanted to highlight here, one of my colleagues recently published this resource called Visioning Towards a Decolonized Indigenous-Centered Service Model for Drug Checking. And it's a fantastic resource for, I think, supporting these sorts of steps that universities should be taking and thinking about. Why do they have the drug policies that they do? What do those look like? And as a colonial institution, how are they working to address the harms of colonialization, including the inequitable harms for Indigenous populations when it comes to harms from unregulated drugs? And along those same lines, drug checking can't just be implemented as a one-off technical solution. Like I was saying earlier, it can't just be a plug and play of like, oh, we have drug checking, now we solve the problem. It's a contextualized social practice. You want to be introducing the workshops, you want to be changing the language on campus, you want to be changing the culture on campus so that people feel comfortable accessing these things and they know how and why and where they're doing these things to be able to shift the narrative around it. And without that, the inadequate drug checking policy makes the intervention vulnerable to fluctuating political interest, funding, and adoption hesitancy, which we saw with the program in the Okanagan. So a few recommendations to take away from this is one, that government guidelines need to move beyond overdose responses to upstream community building strategies that account for the depth and breadth of student substance use experiences, which I think needs to include the benefits that a lot of students were reporting to us coming out of different psychedelic experiences and supporting them and using those in ways that can be informed and reduce their risk of harm. And post-secondary drug-related policies need to account for evidence-informed practices, including preventing stigma and enhancing resource access. And post-secondary experiential education models that include drug checker training should be implemented and evaluated, including exploration of staffing models that offset turnover and longitudinal evaluations of career trajectories and impacts on the harm reduction field. And I also wanted to leave a final note to students that your voices have power. You are the power behind the institution, and students who use drugs matter and your experiences matter, and you should be able to access the resources that you need in a student-centric way on your campus. So I'm always happy to talk to people about how they can do this, what that advocacy work looks like, how you can better push those sorts of things forward. And I wanted to thank all the different partners who were involved in the development of the harm reduction team at UBCO, as well as who contributed to the research study that I shared about today. Yeah, happy to take some questions. I know we're tight for time, but I really appreciate everyone listening to everything I had to say. So, uh,
Thank you for that presentation. That was amazing. I think Naomi has a question, so I'll let them go first. I'll let her go first.
Hi, yeah, I don't know if you can hear me.
mhm.
Okay, perfect. I am super happy and grateful that you did this presentation. It's really, really useful information. Um, I am currently at the University of Calgary, working there. Harm reduction student support advisor is my job title. So looking at these things is like a huge interest of mine. And I just am curious, when you were initially like getting things kind of going off the ground, you had mentioned that you worked with some student groups and kind of approached it from the perspective of like, we're going to set this up and get it going, and then we're going to say, this is happening. Were you like an employed staff at that point, or were you approaching that from the student angle?
Yeah, I was an employed staff. I just finished my master's and it was before my PhD. And so it was a very high risk move for sure. My colleague and I, before, um, in that 48 hours before we brought drug checking services on campus, I remember us sitting in the office and being like, we're maybe about to lose our jobs. I don't know what's going to happen. Like it was definitely a very high risk move for us. And we went about it fairly strategically in terms of like, we went to administration at the same time that mass advertising went out about the drug checking service. So it was like, everyone's expecting this to be on campus. What do you think? um, so it was, yeah, an interesting move on our part, and one that like I won't tell people to break rules or push things or whatever, but I think we are in a public health crisis, and I get tired of people forgetting that. And universities aren't exempt from that, and we need to do big radical things to address this public health crisis. And I think um, the bureaucracy that exists in post-secondary institutions can make these things really drag out for a long, long time. Like the amount of discussions you can have just about the meaning of a single word. I've been in so many meetings like that. So it was like, let's just get this rolling. And at the time that we did that too, like naloxone wasn't even allowed in events on campus at that time because they thought that naloxone could be used as a weapon. So we were really starting from like back here when we jumped from naloxone not being allowed into events to being like, well, we're going to bring drug checking. So, but it opened up the conversations with the administrative leadership folks on campus. We got to sit at those tables, then have those conversations. It helped them see that we were serious. It helped them see the benefits to the student population. It helped them see that students were really interested in using that. So they were really great about sitting down with us and saying like, okay, explain this to us. Why should we do this? What's the evidence behind it? We brought in the medical health officer. We brought in different harm reduction experts to have these conversations with like risk and operations management and security and all these different leaders on campus to explain like, here's the evidence, here's the landscape, here's why we should do this. So yeah, it was an interesting way to go about it, but it was successful ultimately.
I just want to say like major props for doing that. Yeah, it's an interesting thing to think about. Like we've got some traction on our campus in a couple of ways, mostly in terms of like the testing strips and different like educational initiatives and resource distribution, but the actual testing, like the drug checking, is very much not even in its infancy stage. So I'll be thinking about that for sure.
Yeah, and I'm happy to meet with you to talk more one-on-one about different strategies. I would definitely say like partnering with student groups is your number one. They're your allies, right? Because work can happen through student groups and you can like give them all the information, resources, and support. But then if it's being launched through a student club, no one can fire a student club. And students are the people who are paying the university to exist in a certain way. And so if they want something and they bring it onto campus, there's, yeah, a lot of ways to navigate it creatively.
Do we have time for any more questions?
Yeah, if there's more for sure.
I can ask a question. So you mentioned that the program sort of ended last year around this time. So what have you been up to since then? And have you been expanding this program and this technology outside of university settings? Because I can imagine that, for example, in Vancouver downtown east side, this could be an invaluable resource.
Yeah. After the program ended, I spent a lot of time just being very existential. I think it was an interesting time. Um, But the drug checking services thankfully do exist in a lot of different community spaces. So in the downtown east side, there's a number of different drug checking organizations there that operate and exist. And in BC now, I think we have over 40 different drug checking sites. So if you go to the website for the BC Center on Substance Use, they have a really great section on drug checking. They talk about all the different, there's a really cool interactive results dashboard actually, where you can pull up different regions, different cities, look at what the drug supply is there, explore different things. So it's a really cool resource that I definitely recommend checking out and seeing where the other drug checking sites are in the province just to learn more about that. But yeah, so I've worked with a number of those different sites and supporting a few different initiatives. But since things shut down there, I was very focused on finishing my PhD, so put a lot of energy into that. Was working with the Hein Lab at UBC Vancouver, still am working with them, and their students have been doing amazing things and developing some really cool drug checking technologies. I think where the frustrating pause is that, like I shared about those university groups that are doing great things. So the Hein Lab at UBC Vancouver and Substance here at the University of Victoria. But there still isn't investment from universities in these groups at the level that there needs to be. There's still a belief that it's like the community's responsibility, and this is part of my beef and what I push for as a researcher and as a nurse is that, like, well, if the universities are planting themselves as these colonial institutions onto Indigenous land and you're bringing all of these people there, you can't just dump a bunch of people into the public sector and say, okay, now deal with all these students that we brought in here. It's like, wait a second, you also have a responsibility to them. And how are you taking care of that community that you've then built here? And what does that mean? And how you're sharing those resources? So I think we need to see an increase in investments, and that's something I continue to advocate for and sit in meetings for and help people develop resources around. One thing we're doing right now is developing a toolkit to support universities in the implementation of drug checking services. And so we just applied for a grant. Hopefully we'll get some funding to support the development of that. But I'm trying to find a way to get these resources out to universities because it does feel like such a complex, daunting thing. And in that kind of an institution to say, like, yeah, we're going to bring this in. So we want to take the learnings from our experience here and from other partners that I've worked with to say, like, how can you do that well? And here's the resources to do that. And here's how we can support you. So working on developing that. So that's through Hein Lab, UBC Vancouver, we're doing some things. Also supporting work at the University of Victoria here and thinking about how can we get drug checking onto campus, because Substance provides a really great service in the community here, but hasn't been able to get onto campus yet. So it's really interesting looking at the ways that different universities handle these things too, because some universities are concerned about if they're delivering drug checking services in the community, what sort of liability is carried around the potential risks there. Whereas, like, so in the case of UBCO, that was some of the concerns, whereas they were totally okay with having drug checking on campus, because there was less of a liability piece there for them, I guess, if it was not in the community, but it was on university territory sort of thing. Whereas for other universities, it's like, oh, go ahead, do that in the community, but don't bring it onto campus, because then everyone's going to ask us questions about, oh, we're pushing drug use with our students. And then we also see the differences between the protection of a drug checking program being housed under a program of research, because if something's research, it benefits the university in all these different grant funded publication kind of ways. But if it's considered a student service, it's actually not as protected, because then you can't call it research and there's all these limitations around it. So there's so many interesting nuances, and so many universities look at it in different ways. But yeah, so I'm working with people to support them in those journeys. And then also in my postdoctoral fellowship, with Substance at the University of Victoria here, and helping to figure out how we can basically streamline, fortify, expand experiential education opportunities for students so that they can get more experience in harm reduction when they are at university.
That sounds great. Does anyone have any other questions quickly before Lauren has to leave?
Uh, just a word of gratitude for the way that she has presented and for the way that she's responded, even in this last set of comments about the current climate with respect to our post-secondary institutions and communities and sense of responsibility and sense of fear and all of these things. I really appreciate that.
Thank you. Yeah, I could talk about this forever. I love discussing these things with people, so I appreciate the engagement. And mentioned earlier, I'll have to run off because I'm gonna jump on a ferry and go provide drug checking at a fun little festival on an island now. So lots of drug checking in lots of spaces. But
I do have to present a concluding slide, but before I do that, I just want to ask the participants, this meeting is being recorded, so when you spoke, would you like that part to be removed from the final recording?
No need on my part.
All good. Yeah, you can keep it in.
Okay, great. So I will present that final slide for everyone, and then we can end the meeting. So thank you, Lauren, and everyone for coming today. Our next session is on July 18th with Dr. Leanna Toulis Robinson and Sheldamar Elliott from Dr. Monica Williams' lab in the University of Ottawa on the topic of equity in psychedelic research. Join our mailing list to get updates when registration is open and about all our other initiatives. And you can also visit our webpage for the recording of today's session as well as past ones. Feel free to email MAPS Canada if you want to present or want to see anyone else present. And we really appreciate your attendance via donation today. Please consider, if possible, to make any further donation to MAPS Canada's general fund to support all our initiatives to expand safe, legal, and equitable access to research. There are some links that I'll quickly share in the chat. These are links to our mailing list, which also has updates on future MAPS Canada research rooms. And Lauren, you are also free to attend any of these future meetings.
thanks so much. I forgot to mention as well, if folks are interested, you can go to YouTube and actually maybe I'll pull up the link really quick and throw it in the chat. And then but it's another presentation that we did on another aspect of this research project, which was looking at universities supporting drug checking, the development of drug checking technicians, basically. So it ties in nicely if people wanting to check it out at all. This is the link for it. Yeah.
I'll definitely check it out. This is a very informative presentation.
So, thank you so much, everyone.